Hi everyone, my name is Matthew McKenzie, former mental health carer. When I mean mental health carer, that's specifically for a person or an unpaid carer caring for someone suffering mental ill health. Now this video is just, I'd say, a promo, which I'm getting used to in some sense, so it's going to still be some hitches I would think, in just promoting my unpaid carer newsletter. It's an online one. This is what you see before you here. This is the February release. I did do a video for January, which was very short, just because I'm trying to get to grips in using different methods and techniques in pushing the awareness, of raising awareness of unpaid carers. So obviously the whole point really is to pick up really important events each month, not only just on unpaid carers and not just only on mental health carers, but also on mental health per se, and on ethnic and diversity and black mental health and how it affects the communities. I won't spend too long on this video because I probably could talk for a whole hour, and I'd rather people actually read up on the carers newsletter, which is what you see in the video before you. Lots of information here. I usually start off by putting links to videos that have been released during February. I won't go into too much of that, but before I go further on, if I could just open up a new tab, go into my website, which is called A Care in Mind, and the site address for that is careinmindblog.com. And if you wish to sign up for this newsletter or go on the main list, you can look for a link called February Care News Release Updates. There'll be a link called Sign Up to the news site here. Scroll down, and also to get in the main list you need to put your email address, name and last name. So let's go back to the actual information regarding what I've released for February. Very important events for February if you're an unpaid carer. Not just unpaid carer, I've got a few staff that works for NHS trusts and carer campaigners nationally, and carers themselves. Now I'll split up my carers newsletter into several sections. Obviously what you see before you here is the carer video section. One thing I've noticed, really important stuff, and thanks to ITV, thanks to the Lorraine chat on her show, raising awareness of unpaid carers and carers themselves. One item, and I can't really play the video, I don't play it for too long I suppose. I think this is the Lorraine one. I don't know if you'd hear it. It's actually coming off Loose Women, actually, not Lorraine. Sorry, my mistake. I won't play it for too long because, to be honest, there's just not enough time. But this is actually the reaction to an interview done on, I believe, Lorraine, in regards to Kate Garraway's documentary on the struggles of being a carer. And I think I have a link to that off my newsletter somewhere down here. I won't go to it as yet. So let me just close that. The other one you've just saw flash before you was something really interesting regarding care, the actual virtual carers centre that I think they're setting up, and it's only half an hour. It's done by Dementia's Carers Count, and it's with a discussion or topic by clinical psychologist Jemima Fitzgerald on the situation dementia carers face. So again, feel free, the link is here, somewhere around here I think. I think here it is, the Q&A carers well-being. There are other videos here. I have the first one is the actual one I mentioned earlier on, which is the tsunami of loneliness. Again, it's going to probably play, so I'm going to stop that. There's always these adverts coming up. But obviously, that's how YouTube makes their money. You can't avoid it fully. Going to the next bit, something that I've contributed to as well. Also, do take note, I've added care podcast series that I've been working on. It's taken some time to do, but I'm doing that for the long term. And I talk about discussions related to what unpaid carers face. And sometimes I'll just come out and just say carers, like for instance, as you can see here. dealing with bad news as a carer. Obviously, when you click on that, it's going to open up an audio podcast. And for this year, I'm working on my third book, which is on poetry. Again, I'm not going to spend too long on that because I want to get to the meat and the bones, the juicy stuff that unpaid carers need to pay attention to. Any important stuff regarding February. But if you want to listen to my poems, go ahead, I don't mind. Again, I've just put 5 here, mainly audio stuff. This is perhaps the main section where you can see your latest care and mental health news items. But this point is actually going to be just all unpaid care. It's not going to go for the whole lot of them. There's no way. It'll take too long. But what I've done is I'm going to just talk about a few which I think is quite important. They're all important in their own right. But the first one, which is I've included as a link, is the actual release for the 28th of Feb. Unpaid carers continue to suffer poor health. I'm sure that's not news, and it is sad news in some sense. I'm sure it's not new news, if you know what I mean. It's obvious unpaid carers do suffer a lot. The good thing is that Carers UK, national carers charity that fights really hard for unpaid carers, have released several reports. One of them is on their annual, I think it's GP patient survey, looking at primary health care and how that affects unpaid carers. Bit of a read, but highly recommended. Just hot off the press, as you can see by the date in the day of this video, the 20th of Feb, how unpaid carers continue to suffer poor health. Is also particularly pointing out specific groups of unpaid carers, as you can see from the analysis found here. Again, I'm not going to read that out. I'm going to leave that for yourselves to look at. Obviously, I have got involved because, as you can see, I'm the co-chair of the Carers UK Black, Asian, Minority, Ethnic Carers Forum. We'll probably be meeting again at this point during the year, several times. It's not just on diverse and ethnic communities, but LGBTQ. One thing to note is what's obviously I find worrying, and I've mentioned it before, it is a particularly stressful time for carers. It's added more isolation, more poor health, obviously from the COVID situation. But to be honest, resources for unpaid carers wasn't that brilliant in the first place before the pandemic hit. Take note to what is said here regarding this article, this report. And Carers UK, if I can just point this out quickly before going to the next news item, they're particularly calling for GP practices to identify carers quickly and make services available as soon as possible. Going away from that, we got the next item, another carers charity, and this is on Carers Trust. They've been doing their survey as well, and also, I think I'll come on to this survey in a bit, not too heavily, but also what was big for February is that the government did end the free coronavirus testing, which obviously does, as stated here, has implications for unpaid carers. Now, quite rightly, even though this is the 22nd of February, we're still keeping in that month. Carers UK mentioned quite a lot of things, they'll be raising this with the government. As you all know, well, not everyone, because otherwise there's no point raising carer awareness. Unpaid carers are a vulnerable category, and by right, they need protection. Unfortunately, they don't always get this because I personally feel there's a rush, in some sense, to halt coronavirus testing, free testing. So again, this is in the newsletter. Do have a read. Fairly short article, but worth going to. Another thing regarding Carers Trust is that they have a new CEO. It's actually not appeared here. This is on another news item, but if I scroll down a bit, this is on the national updates, and I believe this is the one week in. The new CEO is Kirsty McHugh, and you can see this is worth reading because you learn a lot on the campaigns Carers Trust is working on. Absolutely fundamental needed campaigns particularly during this difficult time. Do have a read of it. I've put that in my February newsletter. What you just saw flashed up before you was another item regarding, sometimes do have a moan and groan regarding government, but what I find really important is that they've now revamped their all parliamentary group on carers. I believe I've met the person's actually leading on the group, but we have new members joining this. Actually, it's Dame Caroline Dinich, and she was previously the minister responsible for the Department of Health and Social Care. This is absolutely needed now. There's a lot of unresolved issues regarding unpaid care, and particularly the paper on which is going to be revamped on health and social care. I'm sure it's going to be a hot topic. If you're an unpaid carer, do keep an eye on what this important group will be discussing, what they plan to do. Again, we have Carers UK on how pleased they are regarding the reboot of this parliamentary group. And again, the link to that is in this main bit here. I'm going to quickly rush on because I know some of the stuff that I've picked up can take time, and I don't seem to be always aware of time. I'm going to go to another section, so picking out some of the important stuff. Do note they all are important. Lots of stuff here. Workshops designed, and which I'll highlight in case you can't see, because I do add stuff from Mental Health Trust. The reason I've added that is because my specific awareness is on mental health carers, so I might pick up a few things from Mental Health Trust. This one from Oxford Mental Health. Obviously, not all carers are from the area, but I understand. But those who have a loved one that is using the services of that trust, it's good to hear that their workshops, it's going to be online, looking at how unpaid cares can be supported regarding how they provide care and support for their loved ones. So certainly do have a look. It's got the dates and specific workshops that they'll be doing. Usually self-harm, dementia, anxiety, all good stuff. I like to take note, this is not the only mental health trusts that have online workshops. There's others as well, but the reason I've mentioned them here is because it's during February, and it's good to see mental health trusts thinking of unpaid carers and providing workshops and information so carers can carry out their role easier. Going back again, what other news items I have? I'm going to scroll down and go to the national organisation updates. This doesn't change as much each time I release a monthly carers newsletter, so some stuff will still probably change there. A good example is the CQC Because We Care campaign, and they often want people to feedback about services that their loved ones use or that they come into themselves. The CQC can only really report and get an idea of the services if we take the time to feedback. It doesn't have to be complaints, it could just be reviews. And the more feedback you give, the better they understand on what they need to look out for. I'm sure they inspect services, and there's quite a few articles I've put in my online newsletter regarding what the CQC are doing. Very important organisation. They have a massive task, made more difficult obviously due to the COVID pandemic. I'm not, this is, even though this is for February, this usually stays in the link for several months until they perhaps change a few things. One thing that I've added for this month, which wasn't in the last January release of my carers newspaper, is the Get Your Mind plan. This is released by NHS England. Again, obviously why it's interested me is because it is to do with mental health. It's got a little quiz here, in fact, so you can see it. I believe it's the third link. So if you click on that, it'll take you to this. Got a little quiz, and it just states how how your mood has been. This has been good. more good days than bad for me. I'm sleeping fairly okay. I've had the odd bad night, meaning that I don't always sleep because I'm always working on something, and that's not always good. Now, how anxious or on edge do you feel? Now, sometimes, I've got to be honest, I'll be interested on what this site, what information it gives. I'm going to be honest, sometimes I do feel anxious. And how stressed do you feel? Sometimes there's a lot of stuff that I'm doing that can cause me stress, not all the time. If for some reason you feel like you're answering the questions not so well, you click back and it takes you back if you want to change anything. I don't particularly want to change anything, so I'm going to go to the next one. And the last one is a very quick quiz. Have you been worried about anything? Obviously, coronavirus pandemic, the cost of living, I've been reading the news, has been worrying. And again, unpaid carers are a vulnerable characteristic. They're not, if you're caring, if you're providing unpaid care, you're not actually working, and you're having to rely on support from the government, which I'm sure many unpaid carers, 7 million of them increasing, are very worried. The cost of fuel, energy is rising very fast. Traumatic events, you've got the Ukraine-Russia war going on. Again, that's very traumatic to those on the news. Don't watch it, obviously, if it's hard to avoid it, if you've got a lot on your mind. And then there's they provide tips. The reason I went to this is because it's fairly quick. They give you advice, 10-minute home workout, stuff to do, meditation, find out more about your mind, do more good things out of interest. I think I'll click on some stuff. You can actually watch some helpful tips. So yeah, do try that out. I'm going to quickly go down. These are events that's happening in, not just in February, actually I'm trying to move them towards the March so people don't miss any important events. Also got resources. Again, that most of them won't change that much because you obviously got Samaritans, Care Services near you. Care Trust has an index of carer centres which are members of Care Trust. They might have some that's not members in that registry. So if you're if you're an unpaid carer, do register yourself as a carer at a care centre. Research and reports and surveys that I've come across, one from UCL regarding diagnosis for dementia and those who care for them. I try and add as many as I can depending on what's released for February. Going down to, I think, 2 more sections. This is on the Pacific mental health regarding diversity. I know the word BAME is going, or is gone. It's going to be a long while because it's been around a long time, and I'm going to try and phase it out. But I do come across information. If you ignore BAME, there is some information here that's quite important. A good one, I suppose, is we start with the first one, promoting Black mental health and wellness. I don't think it's got the word BAME here, but it looks at why is it restricting discussions on racism harms Black mental health, the key points here, and I'm not going to go through it. It's quite a big long article. But some of the key points is how mental health of Black people can be impacted by social political influences. It all adds to the effect on Black people's mental health. Talks on Black students and how they can be targets for racist bullying. It's worth reading when you get the chance. It's not related to unpaid care stuff, but it's something that I particularly work towards in raising awareness of that as well. And sometimes I do merge it, as I mentioned with Carers UK, regarding ethnic or Black carers. So that's one of the, I think, 19 new important things for February regarding I shouldn't say BAME, but ethnic or Black mental health. You say ethnic, it's not always it's not always black mental health. There's stuff on other communities as well, but a fair bit of it will be on black mental health. Another thing that I find very important that I've picked out, again, is what mental health trusts are doing in order to become anti-racist organisations and focus on the importance of black mental health. Some of them, as I say, it'll be a long while before being phased out. I've picked up also healthcare, and they want staff to meet their BAME council. Very important for staff in the NHS have that identity and be honest and open about how it's affecting their workplace. Yes, there's success stories, as the health trust has mentioned here, but there'll be lots of discussions, lots of information, and leadership. Actually, this is something that's very important regarding diverse staff, black and Asian staff working at health trusts. I'm sure I'll be adding more regarding what mental health trusts are doing for the diverse staff. So it's not just always, it's not always good news. Unfortunately, we've got another important information that I've found in February regarding race and mental health. Another one, I don't know if I can quite see it from here. If I can't see it, I'll just pick it out. I think it's this bit here. Section 15, a radical action needed. There was a report that was released showing the racial health inequality in the NHS, released in The Guardian. I can't actually see there. I know it's in February, I'm sure. Yeah, it was actually the 13th of February, as it's shown here. I'll try not to click on it because God knows where it's going to take me. Despite that, it's sad. I'm not surprised, unfortunately. This thing still goes on. And it's got on The Guardian and got on Andrew Gregory, the health editor, reporting on this. It's due to report. I've actually added the report in. If I can just find it, I think the actual report is the next one down. And here it is. A long read, but I do try and go that extra mile. It's in the PDF format. But if you wish, and I know you can, if you have the time, do briefly go for it first. Show us the contributors, going back to the report, about the report, and excuse all the advertisement that's coming up from the actual article. It shows here that racism, discrimination, and barriers to access in healthcare and woeful ethnicity data collection have impacted the health of black, Asian, minority ethnic people in England for years. The report backs this up, released just February this month. Well, actually not this month, because I've just released this usually at the end of the month. But you do understand what I'm getting at. As the time of this video, this is for the February release. It's startling reading. If you don't want to go through the report, at least go through what it says about the article. Lots of information. It does mention IAPS, increasing access to psychological therapy, a massive drive to getting that well-being access to the ethnic community, but if for some reason it's not working. The report will probably highlight this. Due to time, just close the reports and the article. I'm going to go back to the CQC. The last section, well, actually not the last section. The other section is what mental health trusts are doing for carers. I've listed them here, but that bit doesn't usually change that much. I might contact a few of them regarding updates on what they're doing on their site for unpaid carers. But this bit, mental health in general, will change each month. Anything that I consider really important. One of them, there's a lot of stuff I think from the CQC, and I think it's this one here actually. Effects of the pandemic continue to add pressure on mental health services. And the reason that I put this here, because as I mentioned, there's a lot of people who work at these trusts that are signing up to look out, obviously any news that they might need to look out for. Obviously stuff from the CQC. and how it's impacted on mental health services. I'm not going to go into it heavily. It does obviously mention about the long-standing inequalities when accessing mental health care, remain a serious concern for Black British people. A lot of work needs to be done on that, which is why I've talked about it several times in this video. Again, very important read. And lastly, I think there's bits regarding, I'm not going to pick it anymore because of time. I think tips. This is from the BACP, I think it's the British Association of Councils. I might have got that wrong. But tips on looking after your mental health during worrying world events. And I've stressed this again, it's a particularly difficult time across the world when in the middle of hearing about war. That's worrying a lot of people. I'm not going to talk about it too much. I don't want to trigger anything. But it's very, very important. We need solutions as well. And this is a great article. Again, released on the 25th of February. I've added that for a reason. A lot of people are looking around and think, they watch the news and they hear these difficult, terrifying events. How do you cope? And this is really important. They're giving tips. I'm not saying it's going to work for everyone, but it's better than nothing. And due to the increasing pressure on the services, on the mental health services, as pointed out by the CQC, it doesn't hurt to look out, see what you can do for yourself. I'm going to end this here. But as I said, if you wish to access my online care site, and I'll just go here. I'll usually put it on my blog, as I said, careandmindblog.com. You can either click on the news, this bit here. I don't know if it'll take you there, it might do, and it does, thank goodness. And just scroll down. I've put in links on what I feel is, highlights of some of the important stuff. And the first thing is you can sign up. So again, thanks for watching this video, and I'll do another video. It will be my poems of raising care awareness for the next month. I'll see you again soon.